Hi class, I wanted to take a couple minutes to share my experience with a simulation observation that I completed this week. This observation took place at Roberts Wesleyan College in their simulation lab. Their simulation topic was the care of a stroke patient. Three senior nursing students were randomly assigned to attend. The simulation started with a pre-briefing. The students had been assigned pre-work to complete, including information like the NIH stroke scale and common testing and medications used for stroke patients. Each student participated, some offering information freely and others needed to be prompted by the instructor. The students were also informed of the layout and expectations of the simulation, including reviewing the objectives. Each student would go into the sim room on their own while the others watched, and they watched from a closed, like closed captioning or conference room TV. The first student addressed the patient having the stroke, so they had to identify and pick up on the signs of the stroke and call for more help. The first student then gave handoff to the second student. The second student initiated interventions to treat the stroke, then handed off to the third student. The third student continued to stabilize the patient and then saw an improvement following appropriate interventions. Following all three student simulations, everyone returned to the conference room for a debriefing. So here are some of the things I observed from the simulation and why I think simulation is an effective form of educating our nursing students. Simulation gives students time to think things through. Students can feel or may feel the need to rush when they're with real life patients. In simulation, you could see students making connections by taking their time and sometimes even talking things through out loud. The debrief allows students to learn through reflection. I heard them say things like, I should have done that, or I know better. They corrected their mistakes and spoke on how they sometimes felt pressured to do what the patient wanted, even though they knew that wasn't necessarily the best thing to do at the time. The students watching from the conference room were talking out loud. They were making plans for what to do or what the student in the room should have done. They also acted as a cheerleader from the other side to support the student that was in the room. I think that small groups, such as 3 to 4 students, is ideal. It's important for the students to each have a role to remain engaged. During sim, students are engaged in a very emotional real life experience. One student even became quite emotional at the end of her experience following an error that she had made in the patient aspirating water. So you could see, even though it wasn't a real person, she was definitely very connected to the experience and felt really bad about possibly causing harm to that patient. I like how the instructors reiterated to students that SIM was a safe environment and this was a place to make mistakes and learn from mistakes by adjusting their practice. And lastly, just going to review some of the benefits of using simulation and its usefulness in future teaching. I saw many benefits to including technology and specifically simulation in today's nursing education programs. Technology is allowing students to be more immersed than ever before as students are having a deeper learning experience. Educating nurses through a simulation improves how the student will approach scenarios in the clinical setting, which will only enhance patient care and improve patient outcomes. Some of the benefits of SIM are allowing students to have a safe place to gain competency in skills, communication, and comfort with caring for patients. It gives students and faculty a better understanding of whether students are meeting class or clinical objectives. What did they do well and what do they have to improve on to meet those objectives? SIM can also be used for both formative and summative assessment. I think it's likely the best form of formative assessment as it gives students a hands-on opportunity, and then the debrief allows for true reflection and learning. As summative assessment, faculty can evaluate at the end of the semester or at the end of a unit if the student has met the established objectives of that unit. And those are my thoughts on the simulation observation I attended at Roberts. Thank you for listening.